This is a surgical video showing big bubble DALK in a case of macular corneal dystrophy. Clinical picture showing multiple stromal opacities with intervening haze. To begin with, the center of the cornea is marked. A 6 mm mark is taken around the center of the cornea to guide in trephination. A 7.5 mm trephine is used to create a partial thickness groove. A 30 gauge needle is bent at 45 degrees angle near its hub, with the beveled edge facing downwards. The needle is inserted through the trephined edge. It is advanced further into the paracentral area till 90% of stromal depth is achieved, followed by gradual injection of air bubble. With the formation of big bubble, we can see the downward displacement of the Descemet's membrane. The needle is carefully retracted back. A paracentesis is created to decrease the intraocular pressure. A small horizontal incision is given in the anterior stroma to release the trapped air bubble. Viscoelastic is then injected through the same opening to push back the Descemet's membrane, the movement of which can be appreciated on the IOCT. The corneal stroma is then divided into 4 equal quadrants with the help of a Vanna's scissors. Repeated viscoelastic injections might be needed during this step. Care must be taken to keep the scissors horizontal so as to avoid damage to the underlying Descemet's membrane. Each of the quadrant is then excised with the help of a curved Vanna's. Donor cornea is prepared by staining the tissue with trypan blue dye and stripping off the Descemet's membrane. Viscoelastic agent should be completely washed off before transferring the donor cornea over the host's Descemet membrane, which is followed by the placement of the cardinal sutures. Care must be taken while passing the needle through the host cornea. The interface fluid should be completely dried up with the help of a sponge, and the needle should be passed after lifting the host corneal edge. The cardinal sutures are completed such that the graft is equally distributed, which is confirmed with the formation of a diamond. The rest of the sutures are completed. The graft is tucked in. The graft host junction is checked for any leaks. Finally, the intraoperative OCT can be used to confirm the perfect apposition between the donor graft and the host's descemet membrane. This is postoperative day 1 clinical picture which shows graft edema along with descemet folds. A 1-week post-op showing improved graft clarity. A further follow-up at 2 weeks shows a clear graft with a good visual acuity.